Good afternoon, Hoosiers. Thank you for joining us once again, I hope. Our current COVID executive order will expire this Sunday, and our 30-day public health emergency will expire. That emergency declaration will expire the day following that. And so, I probably should say at the very outset, as we discussed last week, we were trending in the right direction. We have made remarkable progress in relatively a short period of time. This is not a mission accomplished moment, far from it, but there's no denying we have, because of multiple factors, but in large part also because of our actions, or maybe not doing some things, has aided into getting us to the place that we're at right now. And we want to continue to doing all those things that are having a positive impact on where we are as we make our daily reporting and look at the numbers come in, that is helping us slow, as we've said, for over a year, how we slow the spread and keep people out of the hospital and prevent death. And that has, in turn, when you look at our color-coded maps, that has in turn allowed our state, community by community, according to the data that comes in, the numbers that come in, we just report the facts, that has allowed us to be more open than in a long time. And more so than other places around the world. And so from where we were a month ago to where we are today has been, and I don't use that word loosely, remarkable. We want to make sure that the counties can continue to be open, and if you're in blue, you have the ability to be 100% open. And we make some very grounded recommendations in our color-coded maps, but we recognize we're in a good place right now and moving in the right direction. So we're cruising into another very important. We say this; it sounds repetitive, but we're cruising into another important 30-day period. We're going to have the eyes of the world, not just Hoosier eyes upon us, but we're going to have the eyes of the world as we go into March Madness season. We're going to be having not just the 68 teams, but we'll have the Big Ten women's and men's. Now got that to come to Indianapolis. We'll have the Horizon League here. We'll have the Ohio Valley Conference Championship, and then we'll have the Division II men's games being played here, the finals being played here in the state of Indiana. So whether you're in Evansville or you're in central Indiana, Bloomington, West Lafayette, we're going to have a lot of action. And we want to make sure we stay moving the ball up court, not squandering this place. And so that requires us to continue to play offense and defense, just like they're going to do during March. And that will require us to extend both of the orders for another 30 days, providing that if you want to predict anything, you can predict that what we're doing has a positive impact on where we're going. And I think, it deserves a moment of thanks, and just how grateful we are to just think about the numbers that we have shared before. I think about, our hospitalizations. It wasn't too long ago we were 3,300
people
plus. And in January, that number was 1,915. Yesterday, we were at 886, I think. So, yes, we have come down. Our positivity rate, 7-day average positivity rate was not too long ago at over 9%. I always go back to that 16.5% on January 11th, but it was not too long ago, it was 9. Now we're at 4.1 for the last 3 days. So maybe we are seeing some leveling off at 4.1, 4.1, 4.1. Happy to see the testing go back up. We were at 48, and then we dipped down to 20-some thousand and went back up. So we're continuing to test and trace and do those things that matter, and we're seeing our hospitalizations, and we're seeing our deaths drop down as well. Till we have days where they're single digits, but still, when you think about the number just in January, it's a difficult number to digest. And when you think about our average, we talked before about 154 flu deaths on average for the last 5 years. We're
12,000.
Yeah, we're at 12,000 total as we sit here today, and yet we're still, in just the recent past, we're double that 154 in just the past, few weeks, and so yes, these numbers are coming down. Now, the other good thing that I wanted to note, and then I'll pitch it over to Dr. Box, and then she'll pitch it over to Dr. Weaver, and then we've got Steve Cox with Homeland Security with us as well. But the other thing that we have going for us, and others do as well, the good news is not just the number of folks who have recuperated, who have been positive and recuperated, but we're also vaccinating more and more and more. And we have a very efficient, relatively speaking, about as efficient as you can get, operation. And I'm just also grateful that so many folks, when at the early outset, folks were predicting, well, if you get 30% or, to take this, and well, we're seeing a much higher percentage. And with every day that goes by, more people say, I got it, and had relatively few, if any, side effects. And that word of mouth, and we're going into every neighborhood, and we're calling on stakeholders. So thank you to all the stakeholders, but we're making sure folks understand that they have access and that others are getting it, and we hope you will too. And I will when my time comes, when you sign my slip, I'll step up and follow suit. Not until then. But that's making a difference as well as we look at the hundreds of thousands who have been positive and recuperated, and when we look at the hundreds of thousands who have been not just vaccinated once but got their second dose. Then on comes J&J. We hope. We'll learn more this weekend, I guess, but it looks like that's headed in the right direction too. So that's going to be adding into the equation, and that really is that kind of roadmap to the moment where we can make some really good big decisions. But we've got this period of time where we're moving in the right direction. We've got 68 teams coming from all over the country, and then we're looking at you always talk about the 30 days in May and the race at the end, but these next 30 days are pretty important as well, just as important as the last 30.
Absolutely.
So we want to continue to take the steps that are working. And with that, you might want to just go over the individual numbers, and then we'll hear from Dr. Lindsay about how the vaccination process is still playing out.
All right. Thank you, Governor. Good afternoon, Hoosiers. This is shaping up to be an exciting week related to the COVID-19 vaccine. We have received all of the doses that were delayed due to bad weather from last week, and we're receiving our regular allotments for this week. We were able to open eligibility to Hoosiers 60 to 64 yesterday and have already seen nearly 112,000 people in that age group schedule appointments. That is more than 1/4 of the eligible population in that age group. When you add in the healthcare workers and first responders who were previously eligible for vaccine, nearly 37% of people ages 60 to 64 have now scheduled a vaccine appointment. I want to thank our partners at 211 for their role in getting so many people scheduled yesterday. They answered nearly 27,000 calls and scheduled nearly 15,000 vaccine appointments yesterday. We also are eagerly watching for the outcome of this week's FDA and CDC meetings on the Johnson & Johnson vaccine. If the vaccine receives its emergency use authorization, we could begin receiving vaccine and seeing it arrive in our states very soon, potentially next week. Dr. Weaver will share more on this. While this is all exciting news, we know that we still do not have enough vaccine to put in a shot in the arm of everyone who wants one. That is why we continue to stress to clinics the importance of following the state eligibility guidelines. Our age-based approach is driven by data and is designed to prevent hospitalizations and to save the most lives. And when clinics don't follow those guidelines, whether it's for overall eligibility or for their wait lists, they create inequities around the state or even within individual communities. When we learn about a clinic that has deviated from the eligibility guidelines, we reach out to find out why and to re-educate them about the importance of following the state's priority list. In most cases, this conversation is effective and we see adherence to the guidelines going forward. I want to emphasize that the clinics have been amazing partners to us. To have administered as many vaccines as we have in such a short amount of time is a testament to all of their hard work. Unfortunately, there have been instances recently in which a clinic has ignored the guidelines and hosted special clinics for ineligible individuals. In these cases, we have told the clinics that we will not provide them with any additional first dose vaccines at this time. We will, however, provide enough to be able to cover the second doses for the individuals who were vaccinated. And we will work with them to develop a corrective plan of action to determine our next steps. And we will reallocate the doses initially intended for these clinics to other sites within the county so that the county's total allocation is not negatively impacted. We are not trying to be the vaccine police. That is the last thing we want to be. We are trying to ensure that we have ethical and equitable access to the vaccine across all 92 counties based on what the data show are the highest risk individuals here in the state of Indiana. We cannot achieve that goal if sites deviate from the guidelines. We are committed to working through issues and establishing new procedures, but while the vaccine remains a scarce resource, we need to ensure that everyone is following the same guidelines. We have a lot to be proud of in our vaccine rollout, and that's where we need to keep our focus. This week, we have increased shipments of masks and other supplies to critical industry, businesses, and schools. To date, we have shipped 204 orders to businesses consisting of nearly 19,000 KN95 masks, 604 gallons of hand sanitizer, and 23,000 packets of small sanitizer. Nearly 280 schools have received deliveries so far, with another 41 expected to be completed by Friday. These shipments include nearly 19,000 Bionex Now rapid tests, 97,000 youth masks, 97,000 KN95 masks, 76,000 gowns, 76,000 gloves, 43,000 gowns, and 278 bundles of sanitizer, shields, and masks. We are also encouraged to see continued improvement in our positivity rate. Today it stands at 4.1%, which is down once again from last week's rate of 4.7%. We also have seen another decline in the number of Hoosiers hospitalized with COVID-19 symptoms. The number of Hoosiers hospitalized with symptoms of COVID has dropped below 900 for the first time since late September. Hospital admissions for COVID are running at about 100 a day, which is a vast improvement from the more than 500 new daily admissions we saw in late November and early December. Our color-coded county maps are looking better and better. Once again this week, we have no counties in red on our 2-score map. A total of 39 counties are in blue, up from 11 last week. All but 3 other counties are in yellow. Our advisory map, which indicates the level of restrictions that counties must follow, shows 10 counties in orange, down from 42 last week, and no counties in red. 9 counties have moved to the blue advisory level. The majority of the state is at a yellow advisory level. The number of deaths that we're seeing has fallen into double digits consistently. Today, we reported 14 new deaths, which brings our total lives lost to nearly 12,500 when you include both confirmed and clinically diagnosed deaths. Even though many of our metrics have improved significantly, now is not the time to abandon the protections that we have put in place. We are seeing an increasing number of variants emerge, and our color-coded guidance continues to be a valuable tool that helps communities take the measures best designed to limit the spread of COVID-19. We have received numerous calls from local health departments and city leaders around the state who use the color-coded guidance to inform their local decisions. This is not the time to throw caution to the wind if we want to cross the finish line. The virus continues to mutate, which creates more unknowns. Indiana now has 16 cases that are of the UK variant strain. While the Pfizer and Moderna vaccines have good efficacy against this variant, it is not as effective against some of the others that are emerging around the world. Our best hope at preventing these mutations is getting the majority of our population vaccinated, which will take many more months. In the meantime, we must continue to treat this pandemic with the care it has demanded for almost this past year. And that means wearing a mask, practicing social distancing, washing your hands, staying home if you are ill, and make sure that you get tested if you're sick. Now, Dr. Weaver will share our latest updates on our vaccine distribution.
Thank you, Dr. Box. Nearly 921,000 Hoosiers have received their first dose of vaccine as of today. That's an increase of nearly 87,000 from last week, which is incredible, especially when you consider the impact the inclement weather had on clinic closings. Of those individuals, nearly 480,000 are now fully vaccinated, which represents an increase of nearly 127,000 Hoosiers. When we look at our appointments, nearly 1.9 million appointments have been scheduled since we first began offering vaccine in December, and more are being added every day. For weeks, we have been sharing the percentages of people who have scheduled or received a vaccine by age group. Those numbers have only included people who have registered through our centralized state system and have not included residents of long-term care facilities or those who have been vaccinated through the federal pharmacy program. Today, I am excited to share a bigger picture view of our vaccination progress that includes all Hoosiers who have received a first dose or scheduled a vaccine appointment. 69% of Hoosiers age 80 and older have scheduled or received a vaccine. That number jumps to 70% for Hoosiers age 70 and older. To date, 63% of Hoosiers age 65 to 69 have gotten or scheduled their vaccine, and 38% of those age 60 to 64 have taken that step. This includes more than 114,000 doses that have been administered to residents and staff in long-term care, and that includes both first and second doses. This week, we are expecting 247,000 doses of Pfizer and Moderna vaccine, and we expect 267,000 doses next week. Keep in mind that these amounts cover both first and second doses and do not represent doses available to unique individuals. These amounts are now accounting for the additional doses providers are able to get from Pfizer vaccine vials. That is an increase from 5 to 6 doses per vial of Pfizer. Our vaccine sites and schedules have already been accounting for this, but they are now being accounted for in the allocation numbers. We have additionally received small incremental increases in our allocation. Every day we work to increase vaccine locations, allocation, and build out their schedule. So continue to check back if you have an appointment scheduled several weeks out. As Dr. Box mentioned, we are eagerly awaiting word on whether Johnson & Johnson vaccine will receive its emergency use authorization from the FDA this week. Several meetings are scheduled to consider this beginning Thursday, and if all goes well, we could get news about an EUA this weekend. We have been told that about 2 million Johnson & Johnson doses may be available nationally. We do not know exactly how much Indiana will receive, but we are planning for how quickly we can get these shots administered to Hoosiers. And we will, of course, keep you updated. The Johnson & Johnson vaccine is a single-dose vaccine. It has an 85% efficacy a month out from administration and 0 hospitalizations or deaths, which is exactly what we want to see. This is an amazingly effective vaccine. Remember that the annual flu vaccine is about 40 to 60% effective each year. As I mentioned last week, we plan to continue to expand eligibility in increments down to age 50 as supplies allow us to do so. This age group makes up just over 35% of the population, but accounts for 80% of COVID hospitalizations and nearly 98% of our deaths. As previously announced, we are also working with healthcare providers to reach individuals 16 years and older who have one of 5 comorbidities that put them at high risk for death and hospitalization from COVID-19. Starting this week, in partnership with dialysis facilities across the state, we will be providing vaccine to 10,000 Hoosiers undergoing dialysis. These individuals will be notified by their dialysis provider. We will expand soon to individuals with sickle cell disease, those who have received a solid organ transplant, individuals with Down syndrome, and people who are currently receiving treatment for cancer or have undergone treatment within the last 3 months. They have active primary lung cancer, lymphoma, leukemia, or multiple myeloma. We will be contacting you and will begin outreach soon. If you are in one of these categories, please ensure your provider has your most up-to-date contact information. Providers, please be on the lookout for information on how to enroll your patients. Expanding access to vaccine requires us to look at where doses are available throughout the state and move vaccines from different locations. This week, we are deploying another tool to help with that process. We are sending our mobile vaccine units to 10 sites around the state to provide vaccine in counties where available appointments are already booked for the foreseeable future. These units will be at standalone sites in Bartholomew, Clinton, Dearborn, Greene, Lake, LaPorte, Lawrence, Randolph, Scott, and White counties. These sites will require appointments, which can be made in advance by going to ourshot.in.gov or calling 211. No walk-ups will be permitted, and they will still follow our eligibility requirements. Finally, I want to provide an update on requirements for vaccine eligibility. In addition to meeting age-based requirements, we have informed clinics that we will no longer be administering first doses to people who live in other states. Initially, we offered the vaccine to people who lived in other states but worked in Indiana to ensure that we could cover our healthcare workers and first responders. This was designed to help protect our healthcare infrastructure. At this time, the majority of those populations have received a vaccine, and the capacity of our healthcare systems has improved. That is why we have decided to limit vaccine to Indiana residents only, so that every dose received in Indiana goes to Hoosiers. Please be prepared to show a utility bill, piece of mail, or other documentation to prove that you're an Indiana resident when you arrive at a vaccine clinic. If you're one of the approximately 19,000 people from out of state who received a first dose in Indiana, we will still administer your second dose. But we will not schedule new first doses for non-residents going forward. I would like to close by echoing what Dr. Bach said. Our vaccine clinics have been amazing partners. This is a tremendous undertaking, but is likely the most important thing many of us will do in our lifetime. We are incredibly grateful for the partnerships and support that are making it possible to move forward to better days. Thank you.
Teamwork. Thanks, Lindsay. Steve Cox, are you on deck? Steve's going to give us an update on the Homebound Hoosier program.
Good afternoon. Thank you, Governor. The Indiana Department of Homeland Security has been working diligently since the beginning of the COVID-19 pandemic to support the efforts of all public safety professionals across the state of Indiana. With 24/7 response capabilities, a community presence in every part of our state, and a highly skilled and well-trained mobile workforce, Fire and EMS stand ready at the intersection of public safety, public health, and healthcare. I'm excited to tell you more today about the Homebound Hoosier program, as this program represents a wonderful collaborative effort involving the Indiana Family Social Services Administration, or FSSA, the Indiana Department of Homeland Security, the Indiana Department of Health, and local public health departments and local fire and EMS provider agencies and numerous other key stakeholders. At its core, the Homebound Hoosier program is designed to get COVID-19 vaccine to Hoosiers that would otherwise not have access to this life-saving treatment. The program matches available vaccine from local health departments with truly homebound individuals in their service areas, and then utilizes local EMS and fire agencies in those communities to deliver and administer the vaccine by bringing it directly to those homebound individuals. It's the perfect partnership of public health and public safety, ensuring the delivery of non-emergent care to one of our most vulnerable populations. We call that community paramedicine. And this program works to fulfill one of the governor's 2020 Next Level Agenda initiatives. Homebound Hoosiers are identified by the FSSA Local Area Agencies on Aging, or AAAs, and are entered into a secure cloud-based portal. Just to be clear, these individuals must also meet the IDOH vaccine eligibility criteria. As vaccine becomes available from the local health departments through appointment cancellations, no-shows, or what might be considered extra doses, they're matched with the recipient on the list. EMS provider agencies in those areas are then engaged to respond to the local health department, obtain the vaccine, and administer it to the individual in their home or residence. While vaccine supply is currently constrained, the program has been well received both here at home, in Indiana, and across the country. The Homebound Hoosier program has gained regional and national attention as a model for success in vaccinating homebound residents. Programmatic overviews have been shared with FEMA, the CDC, and EMS provider agencies in numerous states to discuss the program and to replicate its success in other states. As vaccine supplies continue to improve, we anticipate the program will expand and ultimately be able to reach more homebound individuals. FSSA, IDHS, IDOH, and all of the stakeholders are humbled at the support and enthusiasm this program has generated as it reaches our most vulnerable homebound individuals throughout the state. Thank you.
Rachel, you want to cue up the Homebound Hoosier program video that we have to share?
Hi, it's Susie with Homebound, South Bend Fire Department.
Hi, welcome.
Hi,
Come
thank
on
you.
in.
Yeah, I'm thrilled with the state program to vaccinate the homebound. As we all know, there are a number of individuals who have been unable to make it here, and they are at home homebound. And we're thrilled that the EMS, Department of Homeland Security, and State Department of Health are working together with us at the Health Department to vaccinate individuals who can't make it out here.
The Homebound program is really essential in getting fire and EMS personnel out to the communities to get this vaccine so that we can stop the spread and we can get more Hoosiers vaccinated.
This is super important for our community, and it is a relief to these folks to know that they can get them so that they won't get the COVID. Nobody wants the COVID-19.
It's like a new lease on life. We can have our grandkids come in, still need to be careful, I know, and wear our masks and everything, but with Larry being so sick, he was unable to go with me when I got my vaccine, so we're thankful.
We're trying to create a safer community, a safer city, a safer state, and a safer country for everybody, no matter whether you are actually able to get the vaccine on your own or if you need some assistance.
Relax your arm. Done.
Just like to thank all of you who are participating in the Homebound program. It's a very, very important aspect of the vaccination of our county and of our state, and just thank you for doing it.
We're just grateful that you guys came out so quickly and gave Larry his vaccination.
Thank you.
All right. Well, Steve Cox, I know your hometown is South Bend, and I recognized a lot of South Bend faces in that good video. And I guess Susie kind of sums it all up. She said nobody wants the COVID, and if you've talked to someone that's had it, boy, is Susie right. Rachel, you want to start the round of questioning?
Brock Turner, WFIU.
Afternoon, Brock.
Good afternoon, Governor. I have one question for you and then one for the doctors. We'll probably start off with the doctors if that's okay. health officials in rural counties tell me that up to 50% of vaccine appointments in some counties are being taken up by folks that don't live there. Curious whether or not you all believe this is an issue, and if so, what can be done? Didn't know if you were aware of that.
We certainly have had individuals talk about the fact that they would like to potentially only vaccinate their own county. We really feel strongly that we're all Hoosiers and that we should be able to go. Maybe potentially is not the county we live in, but it's where our son or daughter lives, and they're going to be able to take us. It's close to where we work. Whatever it is that helps to facilitate to get this vaccine in people's arms is what we support. We do look, however, across the state, and part of the mobile units that we're doing this week are really, they're going out mostly to many of our rural areas where we know there were not as many appointments available. We would love to be able to just give the vaccine to some of these smaller clinics, but it's the Pfizer vaccine, which requires the ultra-low storage, reconstitution in the field, and it's a little more difficult to work with. But as we go forward and start to shuffle vaccines around, we have some major local health departments that have raised their hands and said, hey, I will take the Pfizer vaccine. I just need the ultra-low storage, and we'll be set. And then we can start to redistribute the Moderna vaccine, which is a little bit easier to work with. So our answer is, although we are really focused on you being an Indiana resident now, or you're living here in Indiana with your family potentially to get the vaccine, we believe that wherever you go, if you're a Hoosier, you should be able to get the vaccine.
I appreciate that clarification. Thank you. And then some of those same health officials tell me that they're relying on volunteers, and that the money allocated from the state in some circumstances for counties, around $40,000 for the smallest counties, is not enough. And they're worried that if those volunteers leave, they're not going to be able to vaccinate as many people. Are there more funds available that can go to those counties, or is what's been allocated all there is?
Yes, absolutely. In fact, many smaller counties have reached out to us and asked for Guard members to be embedded with them to help. We have made grants available so that they can hire local EMS or paramedicine individuals to run their sites. And there is certainly more money coming in the grants that we will be able to support that. So anyone that's actually struggling with that just needs to reach out to us, and we are absolutely willing and able to help you with that.
This is where we shine. Mm-hmm. Brock, you had a question for me as well?
I think Dr. Box took your question, so I'm good.
Sorry.
If you want to comment on that, feel free.
I have nothing to clean up. Yeah, no, but I mean, obviously she's right, and we're doing this all over the state of Indiana, and this is where, kind of when you look at, yeah, we have our state border, but just imagine there being no lines. Like, we're trying to care for, we're living by the golden rule. We want to treat each other like we want to be treated, and that means if it crosses over one street or one county, so be it. Let's get it done. Faster the better.
Eric Berman, WIBC.
Afternoon, Eric.
Afternoon, Governor. I have a couple of questions for the doctors in the House. Dr. Box, you referenced some clinics that won't receive further doses because they've been letting people jump the queue. Can you elaborate on that a little bit? How many clinics, which ones, and where? And am I following this correctly, that they get a warning first, and then these are clinics that have persisted in doing that?
You know, there have been instances, Eric, across the state, and most of those instances, it just simply requires a phone call, a clarification of what happens. Many times it actually, on social media or on other things, was blown out of proportion and was not actually what happened. Sometimes it's a simple re-education. A lot of times it's been centered around the eligibility with regards to a wait list and the importance of that wait list reflecting either the current eligibility that we have opened up at the state level or those age groups that are close to that. There have been a rare instance, I would say, where individuals have really gone way outside the guidelines, and that is a situation where we ask that we basically said they would no longer receive first doses from us, but they would receive the second doses to finish up anybody they had vaccinated. But that is with the plan that as we go forward, we can work with those individuals at these really amazing, great clinic sites that have been great partners to us so that we can further educate and remove any barriers to them following the eligibility guidelines of the state, and for us to be able to be reassured that going forward, that's not going to be an issue. So I have no doubt that it won't be long before they'll be back a complete and full vaccination partner of ours.
You had a second question, Eric, or was that contained in?
I can unmute myself. Excellent. Just following up, how widespread is this? I mean, how many counties have you had that kind of situation? And you mentioned that you're going to be able to find replacements so that those counties aren't out of luck. How do you actually do that?
Yeah.
So every county, for the most part, has more than one site, and we just simply ask the other sites if they would be able to take on additional vaccine and to get that vaccine into arms. And again, this has been a very localized number of sites that we've dealt with in a more significant fashion. And, I really believe this is just important so that Hoosiers understand that we take very seriously our eligibility rules. It's heartbreaking to see the number of 60-year-olds and individuals with cancer and individuals that are on renal dialysis, individuals that have solid organ transplant who know their risk is extremely high, and how patiently they have waited for their time and their opportunity to open up to get the vaccine, just to have them find out that there are healthy 20, 30, 40-year-olds that are getting the vaccine before them. So we really feel strongly that we have made these eligibility decisions in a very good evidence-based manner in order to save lives and prevent hospitalizations, and we will stand by that.
Yeah, and we underscore, Eric, the clarity of it all. I mean, we're trying to keep this very straightforward, very predictable. Lindsay, if I could go to you for just a second. I asked you this question earlier today, we had last week's 372 sites. We have 384 today, maybe, but we have the ability to go to 1,000. Could you just elaborate, just piggyback on what Dr. Box just shared about, as you look forward, how you would fold more in, not just because of a conversation that you've had, and by the way, they've all been very good conversations. People are by and large trying to do the right thing, but Lindsay, you just want to go just one level down deeper into how you look to add more and where?
Absolutely. So you're correct. We have 384 sites right now. We are actively going to be adding more sites to our map just this week, and we have the ability to go up to over 1,000 sites across Indiana. We have had so many Hoosiers, entities, clinics, pharmacies raise their hand and say, when you have enough vaccine, we're ready for it. And they're already enrolled to be a COVID-19 vaccine provider. We look geographically about where does it make sense so that we have an even distribution of clinic sites. We want to keep in mind and make it as easy as possible for Hoosiers to be able to access the vaccine. And we also look at uptake and populations, right? What population are all of our different counties, our different cities, to make sure we're putting the right number of vaccine in there. And then if a site is unable to increase their number of appointments, or we need somebody in another geographic location, that's when we look to add more sites.
Yeah. So it wasn't by accident that you were in Greene County with a mobile unit, or Lawrence, et cetera. Right.
Dominic with WTHI.
Afternoon, Dominic.
Dominic, you have to unmute your own microphone.
Good afternoon. Can you hear me?
Yes, crystal clear.
Yeah, okay. Well, good afternoon. Appreciate you taking my question. Just a quick question, just one. Recently, we've had some state reps around the area kind of push for teachers to get vaccines. And apologies if this is a repeat question, but haven't been able to ask in recent weeks. But I know age-based focus is your focus, and you've made that very clear. Just wanted to gauge any ideas on expanding that to teachers once we hit that maybe 50 and up age range, and we tackle those people with comorbidities, if teachers at all being considered for a group maybe next in line. Just been hearing some recent rumblings and wanted to get your thoughts. Thank you.
Yeah, it is not the first time we've had the question, Dominic, and happy to answer it again. And considering, as you stated in the question, how you look ahead once we get through, and that is obviously, as we're looking to adding a whole nother 5-year increments, about 450,000 on average group, and when you go down then to 50 to 59 is 857,000. So while we are getting more supply, Dominic, it's being allocated to these areas as we add in the comorbidities. And just like I'm not going to cut in line, the professions don't put you in a higher risk as the information that you've supplied me, it's actually the age and your comorbidity. So we'll continue to go down that path. And if we get into this situation to where the science or the data or the facts, or once we get through the folks who are on dialysis or have sickle cell or have Down syndrome, once we get through all those groups, then we're trying to get to as many people as we can, be it teachers, be it the person that works at the truck stop on I-70 that has a lot of transient customers come in and out from all over the country, and little control over certain actions of others that are only there temporarily, or the folks that work in our grocery stores that are seeing a high turnover and volume of customers coming right in front of them. They're masked up, they're doing all the right things. So it's we don't look at the profession per se right now. We look at the condition. We look at the actual numbers and the data, and that'll continue to guide us. And to answer that second part, and please, Dr. Box, Dr. Lindsay, come in. But I mean, we had 104,000 people yesterday. You sent me word that, or we talked, and you said 104,000. That was, I don't know, by 5 o'clock or something, 3:30.
Easily.
Yeah, easily. So I mean, that's the good news, is the map that shows the percentage of folks who are.
And individuals who are 50 to 64 are more 30 times more likely to die of COVID-19. Yeah. I mean, it's not just that they are a certain age group. And I think the important thing is that it depends a lot on our vaccine. And Dr. Weaver said this multiple times. If we get a huge flood of vaccine, when that happens, that, phase 2 critical infrastructure, our individuals, we want to be able to open up to everybody.
Yeah, and Lindsay, would you just speak once more for just Dominic's benefit and anyone's, that it'll be that task force group that makes these decisions, and you're meeting regularly, but this is the exact kind of question you're dealing with when you huddle up.
Exactly. We review both national, international, and Indiana-specific data about who is at high risk for hospitalizations and death, and we are using that to drive what we're going to do moving forward. We're looking forward to hearing what happens with J&J and the EUA this weekend and recommendations from ACIP. So the Indiana Vaccine Advisory Committee will continue to meet and help advise us which group should we be moving to next when we're worried about hospitalizations and deaths.
Brandon Smith, Indiana Public Broadcasting.
Afternoon, Brandon.
Afternoon, Governor. On the rare number, since you won't tell us an exact number of vaccine sites that have been shut off from the first doses, how many? My first question, and I'll have a second one. But how many people did that force to get rescheduled at other sites? Are we worried about not enough appointments in those areas?
It was basically no individuals at most of the sites, because what we wanted them to do was to finish out the appointments that they already had scheduled, so that Hoosiers would not be disappointed with the fact that they had an appointment scheduled. It was going forward filling additional first appointment sites that we asked them to stop scheduling.
Matt McKinney.
I think
we had another question, I think.
I think Brandon had a follow-up. Brandon, you still with us?
Yes, I am. Thank you.
Yep.
Dr. Box and Governor Holcomb, are you concerned about how many fans will be coming to now apparently attend games at the NCAA tournaments and what that might do to our numbers? And why are we not going to be counting the tests that happen around the NCAA tournaments on the state's dashboard?
Take that?
I'll share my concerns after you
Okay.
share yours. How's that?
So our out-of-state individuals will that MBS data or that lab data gets forwarded to the states, and it goes onto their dashboard. But we will have views into individuals that are being tested. The teams will keep very close accounting of all of the negative tests and any positive tests. Those positive tests will be thoroughly contact traced, and any individual outside of those teams teams, of course, that get tested here, we are doing exactly the same thing. So we're looking at Monroe County Public Health Department, Tippecanoe, at Marion County Public Health Department, all of which are engaged very actively with our teams, and the state will be there supporting that also. So it's not that we're just not going to report all of the negative tests that are being done on a daily basis on all of the basketball team players.
Yeah, and I would say, Brandon, that I too share concerns, but I share concerns about volleyball tournaments. I share concerns about what's being hosted in Evansville. I share the excitement as well that goes along with that. I share concerns about live commencement ceremonies. That's why we work together with our local partners, and we'll continue to do that. The good news is about the specific question you asked is these schools, this is nothing new to these schools. They've been doing this their whole season and before that first tip-off. So this has been institutionalized for them, and they know the parameters once they arrive here on Hoosier soil as well. So absolutely we welcome the competition and the attention that we're going to get, and we'll work together to make sure that it's a successful event.
Matt with RTV6.
Hello, Matt.
Hello, good afternoon. My first question here is about the number of cases. Do we know kind of what factors have kind of fallen into making those numbers decline? You know, I don't know if weather or if it's all vaccine or just people doing what they're supposed to be doing, and how much concern is there about the variants that are out there?
Another concern.
That's an excellent question.
Yeah.
I think it's all the things that you said, Matt. I think it's, we're after the holidays, so there's a little bit less family gatherings and things going on right now. It is very, very cold, so a lot of people are not outside in big congregate settings or in gathering together, even inside in areas. I think people have been following kind of the rules and the regulations, and I think that we went through another scare when our hospitalizations and our deaths and everything went up again so high. I will say that I do believe that the hospitalizations and deaths are being impacted for sure by our vaccinations, and I'm really excited to see that. But I do have grave concerns about the variants of concern that are being found around the nation, the one that we do know we have here. And so, as Dr. Fauci said, the variants are going to make a dent in all of the efficacies of these different vaccines. But the important thing is that they will still continue to prevent hospitalization, severe disease, and death. And that's really the main point about these vaccines.
Yeah, and I think looking back on this, one day when we're able to look back on this and reflect and think about what went right and what didn't go so right, we'll be grateful that we took the approach that we did as we get closer and closer to the end of this tunnel, that we dealt with the folks now who are most at risk of being hospitalized or dying. So as we continue to vaccinate more and more and more, and those numbers do come down, but to express that concern again, when you look around the world or around the country and you see some states might be stubbornly high, or you see Germany or Italy say, well, wait a second, we're going in the wrong direction, then what we can control, we need to. And it is heartening to see more people doing all they can to do their part to slow the spread.
Drew with Fox 55.
Afternoon, Drew.
Good afternoon, Governor. I've been looking at vaccination rates by county on the Indiana dashboard, and some Indiana counties have a much higher percentage of people vaccinated than others, and it doesn't necessarily correlate with the elderly population.
Yeah.
So can you explain what determines how many doses go out to each county and where some of those differences may be coming from?
Lindsay, you eat, sleep, and breathe this. You want to offer your thoughts?
Yes, we're monitoring the same thing. So we are basing our allocations originally, like I said, on population size. So there may be more vaccine available there, but it's not having as good uptake. So we definitely are seeing some counties that have really high numbers of uptake in their eligible populations, and then other counties are still doing well, but are not quite that high. So that's just another indication that there's more work to do there. And we have been engaging community partners from all across the state to help us start really, talking to their community members about the importance of getting the vaccine. And this really is a partnership. So we hope to see some of those differences start to close over the next month.
Yeah, and I would just say, feel free to pile on, that not just counties, but we still see that disparity between men and women.
And certain races and ethnicities.
Yeah, and so we want to make sure that the word, and we'll continue to do our part. But when I look at the numbers that come in, and it's talk about stubbornly stagnant, men are coming in at just under 40%, and women are consistently 60% or north there, and so we got to continue to get the word out, and we'll be seeking to find more and more ways to express that this works, and it's free, and the sooner we get more people participating, just like do the right thing. The sooner we get more people there, the sooner we're at the end of the tunnel. So, come on, guys.
Kayla Sullivan, Fox 59.
Kayla, afternoon.
Good afternoon. I have two questions.
Sure.
So I just want to expand on the teacher vaccination question, because I feel like, there's a lot of public outrage about it. And I wanted to know, do you take any responsibility for the fact, some teachers were signed up for vaccines and then turned away? Could communication have been better at those sites? I'm sure you sympathize with the teachers who thought they were close to getting their vaccine and then they were let down last minute. And then my second question for the governor is, can you respond to last week's incident on the House floor? Would you support racial bias or cultural competency training at the State House as a result of all of this? And what do you suggest leadership do moving forward?
Anybody want to take the first, and I'll take the second? I'm happy to take them both.
Sure. I think it's important. I've never been in a situation in my life where I didn't say communication could probably be better. I mean, that is always an underlying goal of ours, is to communicate. We do meet and have meetings every single week with all of our federally qualified health clinics and community health clinics, with all of our hospitals. We have met with CVS and Walgreens on a weekly basis since they've been doing vaccinations for us. More and more, it has been oftentimes new sites that are coming on, sometimes with our federal pharmacy partners. And there is confusion from a federal level because different states are doing different things. We do clearly vocalize and send out information about the fact that our eligibility is a certain thing, and when we change that, we send more information out. We're even sending out a newsletter now once a week on Thursdays, just to kind of update every single site about that. So I do believe that this has been communicated, and in the individual situations where we have talked to people, it has been very clear to them what the eligibility in the state of Indiana at that time was.
Yeah, and I would just say, Kayla, that this is an outlier or outliers, very small number of outliers, and we have made sure that we've underscored those eligibility requirements when we're made aware of it. But the silver lining in this, to me, and because I'm just like a teacher, I want them to get vaccinated too. And the good news is they want to get vaccinated, and we'll see if they register in at the 69, 70%. I'm grateful, and when the supply is there, I hope they turn out in droves to get vaccinated, because it'll get us there sooner. As to your second question, obviously, Kayla, I wasn't there, so I didn't hear exactly what went on or what was said. I'm very grateful that this isn't the Parliament in the United Kingdom, where people constantly are shouting over one another. I've tried to lead by example on this front. I concur with Speaker Houston, who said there has to be civility in even the most heated of discussions. That's what I've tried to do. And if I get frustrated after listening to someone before I speak, if I have to bite my lip, then I do. And we're talking about a lot of important topics, all of us in the State House, and as we're spread out now, talking about important policies that affect people's lives. So I can, on one hand, understand the kind of folks feel like they're on edge on every topic because it's just such a weighty time, but that doesn't ever allow us to pitch the golden rule out the window, as I referred to earlier. We need to treat people like we want to be treated. And I appreciate Speaker Houston dealing with what goes on in his house. I'll make sure our house, the executive branch, is consistent on that front.
Michael with WBEZ.
Michael, good afternoon.
Oh, thank you, Governor and Dr. Box and Dr. Weaver. It's been a while since I've had a chance to ask you a question, so bear with me. As you're reporting the good news, are you concerned that as you as governor or future governors won't have the same authority to institute emergency measures as you did when this thing started? Your colleagues in the State House want to curtail your authority. What's your response to that? And my second question is, with Northwest Indiana being so close to being in the blue category, if and when they reach that, how will that open things up even more? What will change of what's happening now?
Second question first, I guess. That this color-coded map and our color-coded the stages is that roadmap. And so you see different counties figuring out ways to safely operate. That's what these recommendations and these policies are all about, is balancing those our lives and our livelihoods, making sure that we can continue to safely conduct our business. And, you know, when that's possible, I'm screaming and cheering from the rooftops. And by the way, I mean, Indianapolis, to go back to Brandon's question, Indianapolis is one of, if not the only city in America that the hotel and convention business is hiring people back. And when you think about Indiana right now having proved, we have going on weeks now, a 4.3% unemployment rate. That means we've got a lot of people, when you go back to last April, back to work, 17.5, 4.3. So this has been, I say all that, Michael, this has been happening now for months on end as the economy continues to not open up, but to grow in the state of Indiana. Just Exhibit A, our January revenue report that came in, $245 million north of what it was forecasted to come in at. So this has been happening. It's going to continue to happen. We just need to continue to practice good public health behavior that will allow us to continue to take advantage of this time as we come out of it. Your second question had to do with exercising executive branch powers. I am concerned, but I'm also as I've said before, including today, constant communication with legislative leaders and members. Understand they represent districts back home. They like to be informed. They like to, not just like, it's part of their job. They serve the citizens who sent them to the State House. So I'm very understanding of that situation and how we make decisions on a 24/7, 365 basis, and getting all that information out of multiple agencies to 150 legislators and mayors and commissioners and health departments and our federal partners. This is around the clock. You all have been working the last 52 weekends on this and on this front, and doing a lot more on top of this, but on just this. And so we got to find that sweet spot of being able to make sure we're working together, that Indiana's known for, by the way, that teamwork, but not slowing down and not having that ability to adjust. As I just mentioned, over the last few weeks, we've made adjustments along the way responsibly. The numbers prove we're on the right path. So, we've got 2 weeks to get this right. I want to make sure, as I've mentioned before, that anything we do is constitutional, and there could be a difference of opinion there. Understandably, it won't be the first time there would have been a constitutional disagreement, but that'll sort itself out as well. But we'll continue to work in earnest over the next 2 months. We've got time, and it'd be my desire to have everyone on the same page, operating harmoniously, and that just strengthens our case for Team Indiana going forward.